In 2016, I worked at a tiny rural hospital in South Africa called Untunjambili. And on one of my first days there, I came across a patient, a 17-year-old female who had been brought in by an ambulance. After she was triaged, I went to go see her, only to find out that she spoke Zulu and I only spoke English. So, 90 minutes later, equipped with a nurse as a translator, I finally found out that she had come in due to a 3-week history of an itchy skull. Now let me set the scene for you. It was 7 p.m. at night. I'd seen about 30 patients since lunch. She was my last patient, and I had a long drive home ahead of me. So with all the patience I could muster, I asked her why she had waited 3 weeks to come in, and with an ambulance no less. I wasn't prepared for the response she gave. You see, she was the oldest of 4 siblings, and looked after them on weekends and afternoons while her gogo, or grandmother, worked. She had no private transport, no money for public transport. So after a week of constant irritation and sleepless nights, she had gotten home from school, broken down, and called the ambulance. While I was making my notes, she called her gogo on WhatsApp to let her know that she'd be sleeping in the hospital reception, as she had no money for transport home. Now, this firstly showed me how truly in the digital age we are, but more importantly, it highlighted how privileged I was, that my biggest frustration was a 90-minute air-conditioned drive home. For a lot of South Africans, unmanageable costs, inaccessible facilities, and language barriers make accessing the healthcare system a bridge too far. This is a story that doctors and patients across South Africa could describe, and leaves many of us wondering, what are the solutions? But before we get there, let me tell you a bit about South Africa's healthcare system. South Africa has a free public and a paid-for private system. And despite making improvements in our healthcare spending, less than half of the total healthcare spending goes to the public system, despite it providing care to over 80% of our population. This is on top of a unique burden of disease exacerbated by HIV and TB, as well as a legacy of apartheid, which has left deep-rooted injustices that persist till today. This drove my passion to study inequalities, but when you look at the extent of the injustices, it's difficult not to feel overwhelmed. So, after moving to the UK to study, I worked in several emergency departments across the country. And one of the most common complaints I've heard from patients is the long waiting times to see GPs. I experienced this firsthand. When I finally needed to see one, I called the GPs in my area to find out that the nearest appointment was 10 days away. So, after speaking to a few colleagues, I decided to try the video consultation app on my phone. After signing up, I got an appointment the same day. It was a good consultation with great communication. I had instant access to my records, and my prescription was sent straight to the pharmacy. So 3 hours after booking my appointment, I had seen my doctor, gotten my medication, and I was back in my room studying. Okay, I was watching Netflix. But the point is, it changed the way I interacted with the healthcare system. Something that was meant to be long and tedious had turned into something that was quick and efficient. Since then, I've spoken to doctors and patients who use the system. And despite its limitations, there's one message that comes through clearly: convenience is key. And this explains why it's supported by the NHS. The benefits they list include increased health knowledge, increased information sharing, but most importantly, improved quality of care. This got me thinking, what is the potential of this technology in South Africa? And I would argue there are 3 main areas it could have the biggest impact: cost, record keeping, and the language barrier. All issues my patients in Untunjambili faced. Now, with respect to cost, given the fact that South Africa has a free public system, the burden of cost is not what you would expect. The poorest South Africans spend over 10% of their total household expenditure on healthcare. This is as opposed to the richest South Africans, who spend just 2.5% accessing a paid private system. The poorest South Africans are 21 times more likely to delay treatment due to cost, spend twice as long actually getting to the facilities, and are 4 times as likely to be dissatisfied with their treatment. So to summarize, South Africa's health inequalities are about as wide as Boris Johnson. And as you can see, that's pretty substantial. Studies from UK GP practices have shown the significant potential for savings with this service. Patients are much more likely to attend their appointment, which saves the practice money. Patients save on transport costs, and it increases convenience on all sides, something that South Africa is desperate for. The second issue is record keeping. Now, most records in South Africa are paper-based and are not allowed to leave the facility with the patient. This is a significant challenge when you consider the fact that 40% of rural households have at least one migrant laborer. And this is not just an issue for them. Most patients access healthcare facilities based on convenience. And when you consider the low levels of health literacy, patients are frequently unaware of the conditions they have or the medications they are taking. On top of that, paper-based records are easily lost, leaving many patients without continuity of care. This problem is not unique to South Africa. When I worked on the Isle of Wight, a popular holiday destination in the UK, the health staff there faced a very similar challenge. And this is why the instant access online consultations give you to your records is essential. Not only does it improve patient knowledge, it also improves your ability to treat your patients. The third issue is the language barrier. Even the simplest conditions have complex backstories, and every doctor can tell you about the curse of the handshake. You finish a thorough consultation, go to shake a patient's hand, and they hit you with, "Oh yeah, doc, one more thing." And this one more thing is inevitably the reason they've come in. Now, while this might be frustrating, it is an important part of the consultation process, and something that's frequently missing when there's a language barrier. South Africa has 11 official languages, and English is only the fourth most spoken language. To my great shame, I'm only fluent in English, and honestly, if you were to ask my English teacher, barely that. This has been a challenge everywhere I've worked, and the solution usually involves asking a nurse to translate for you. But this diverts them from their job, wastes valuable human resources, but most importantly, diminishes patient-doctor connection. Language barriers have been shown to negatively influence the way that patients and staff interact with one another, and one of the saddest outcomes from studies is that patients often feel ashamed. They blame themselves for not being able to communicate properly, and this sours their healthcare experience. Video consultation services offer a partial solution to this by giving patients access to healthcare practitioners in their first language who are culturally sensitive. Not only does this improve the quality of care they receive, it also improves their sentiment towards the healthcare system. One of the saddest realizations I've had since working in the UK is how much patient connection I missed in South Africa. No matter how good your intentions or your translator, it's not the same. And I imagine many of my patients felt the same way. Now, there are several limitations to this service. Many conditions just require a face-to-face meeting, and I've yet to come across a smartphone that can do CPR. Who knows, maybe the S12. But when it comes to primary healthcare, this is where this technology has huge potential. Primary healthcare, which anchors health in communities, is the bedrock of any healthcare system. It provides 90% of a patient's healthcare needs across their lifetime, and is ideally where this technology should be targeted. As time passes, populations are also becoming more tech-savvy, and this is happening across generations. In the last 10 years alone, I've seen my dad go from being a Neanderthal to a Neanderthal who can use an iPad. And I consider this progress. But more importantly, as this technology becomes more ubiquitous, it has the potential to reduce health inequalities by simplifying healthcare for the most disadvantaged groups. I remember how upset my patient in Untunjambili had been when she told me how much stress and anxiety the constant irritation had caused her, and how all of this could have been avoided with a video consultation 3 weeks earlier. How many more sleepless nights could she and many other South Africans avoid with this service? Now, technology alone cannot be the solution to South Africa's healthcare crisis. But as we move towards a system of national health insurance, it is essential that we use every single tool at our disposal to make it the best healthcare system possible. Someone once said, "Good, bad, or indifferent, if you're not investing in new technology, you will be left behind." This technology is increasingly in the hands of the most marginalized and disadvantaged groups. Let's not leave them behind. Thank you.